What is Lurasidone and what does it treat? Lurasidone is a medication that works in the brain to treat schizophrenia. It is also known as a second-generation antipsychotic or atypical antipsychotic. Lurasidone rebalances dopamine and serotonin to improve thinking, mood, and behavior. Symptoms of schizophrenia include hallucinations, imagined voices or images that seem real, delusions, beliefs that are not true, e.g. other people are reading your thoughts, disorganized thinking or trouble organizing your thoughts and making sense, little desire to be around other people, trouble speaking clearly, lack of motivation. Lurasidone may help some or all of the symptoms. How to use? Lurasidone tablets should be taken with food, at least 350 calories, since administration with food significantly increases its absorption. Schizophrenia. The recommended starting dose of Lurasidone is 40 mg by mouth once a day. The dosage may be increased based on individual patient's response or tolerability. For most patients, 40 to 160 mg of Lurasidone per day has been shown to be effective. The maximum recommended dose is 160 mg per day. Depressive episodes associated with bipolar disorder. The recommended starting dose of Lurasidone is 20 mg by mouth once daily, alone or with lithium or valproate. The dosage may be increased based on individual patient's response or tolerability. For most patients, 20 to 120 mg of Lurasidone per day has been shown to be effective. The maximum recommended dose is 120 mg per day. Kidney disease. Dose adjustment is recommended in patients with moderate or severe kidney disease. The recommended starting dose in such patients is 20 mg per day and the dose should not exceed 80 mg per day. Liver disease. Dose adjustment is recommended in patients with moderate or severe liver disease. The recommended starting dose in these patients is 20 mg per day. The dose in patients with moderate liver disease should not exceed 80 mg per day, and the dose in patients with severe liver disease should not exceed 40 mg per day. The safety and effectiveness of Lurasidone has not been established in children. Contraindications. Non-hypersensitivity to Lurasidone hydrochloride or any components. What should I avoid while taking Lurasidone? Avoid drinking alcohol. Dangerous side effects could occur. Avoid driving or operating machinery until you know how Lurasidone will affect you. Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Dizziness or drowsiness can cause falls, accidents, or severe injuries. Grapefruit and grapefruit juice may interact with Lurasidone and lead to unwanted side effects. Avoid the use of grapefruit products while taking Lurasidone. Side effects of Lurasidone. Common side effects include sleepiness or drowsiness, restlessness and feeling like you need to move around, akaphysia, difficulty moving, slow movements, muscle stiffness or tremor, nausea. These are not all the possible side effects of Lurasidone. For more information, ask your healthcare provider or pharmacist.